Today's presentation is titled Empowering Frontline Staff. Empowering frontline staff to become leaders of change. We're so fortunate to have with us Alyssa Richmond, who's very passionate about today's topic. Alyssa's been working as a registered nurse in long-term care for over 8 years. She has extensive experience as a frontline nurse and is currently working as a director of care at Tilbury Manor long-term care home. Throughout her nursing career, Alyssa has obtained a number of certificates, including the Wound Care Certificate through York University and also Fundamentals of Hospice Palliative Care. She has led a number of committees within the long-term care home, such as wound and skin care, infection control, and continence care. She has maintained the home's BPSO Spotlight designation and continues to lead her team through the home's BPSO journey. Alyssa is committed to embedding evidence-based practice into all aspects of resident care. So without further ado, it is my pleasure to present to you our speaker for today, Alyssa Richmond.
Good afternoon, everyone. Thank you, Jamie C, for the introduction. As she mentioned, my name is Alyssa Richmond, and I'm the Director of Care at Tilbury Manor. I'm so excited to be able to share with everyone today our BPSO journey, specifically how we have empowered our frontline staff to become leaders of change. We started our BPSO pre-designation phase in 2016, and by 2019, we became a fully recognized best practice spotlight organization. We have successfully implemented 14 best practice guidelines and have sustained all practice changes throughout our journey. So we are just a small home located in Tilbury, a small area of Tilbury, which is just between Chatham, Kent and Essex County. And we can accommodate up to 75 residents. Today, I'd like to share with you how Tilbury Manor has utilized an interprofessional approach to the implementation of best practice guidelines using a transformational leadership style. I will identify how best practice champions can be utilized to sustain practice changes, how to empower frontline staff to become leaders, and share our successful outcomes related to best practice guideline implementation. From the start of our BPSO journey, it was important to us to make it the work of the home. We have used an interdisciplinary approach by involving all staff members from all departments and maintaining open communication with our residents, families, and external partners. We've worked very closely with our RNAO long-term care coordinator, Beverly Faubert, who has mentored, guided, and supported us through our journey, and who continues to be very active within our home and involved in our continued success. So we realized early on that in order to be successful in this journey, we would need to involve all members of our team. We decided we were going to use a transformational leadership style to implement all practice changes. By using this type of leadership, we were able to empower the frontline registered and non-registered staff and ease the workload of the DOC. We started by reviewing 2 of the healthy work environment guidelines at all staff meetings to empower all of the frontline staff. These guidelines reviewed effective communication techniques, leadership styles, and conflict management. This supported the staff in becoming more effective coaches and mentors, which resulted in trusting and respectful working relationships. This was truly the foundation for initiating practice change within the home. Our RNAO long-term care coordinator attended these meetings as well to provide additional support and guidance to staff. By reviewing these guidelines, we were able to provide our champions with the resources and tools they needed to effectively mentor and educate staff, implement practice changes, and provide peer-to-peer feedback. So this process has helped with buy-in as well from all the staff, as changes were not seen as driven from top down. Our success is truly the work of the home, as we have made it a collaborative effort. So here is a picture of all the 14 best practice guidelines that we have implemented and continue to re-implement annually. So after we reviewed the healthy work environment guidelines with staff and they felt comfortable in those areas, we decided to assign champion leaders to oversee each required program. We chose staff who were dedicated to improving resident care, motivated and empowered to lead others, and that could provide education and support to their peers. Once we had a designated committee leader, education was provided to them to ensure they had a good understanding of all requirements of the Long-Term Care Homes Act for their required program areas, and also an understanding of the facility policies and procedures pertaining to their required programs. Once we started to assign individuals as champions and develop their leadership skills and expertise in their clinical topic, we really noticed that this was also empowering and motivating the other staff to become champions as well. We provide them with time to prepare and perform education, assessments, implementation of practice changes, monitoring and screening, and also evaluations. For our home of 75 beds, we provide 1 day per month for each champion. Educational pamphlets were created by the champions for the residents and families so that they could be informed of the best practice guidelines and changes to care. So pamphlet information for falls and fall prevention and management included proper footwear, least restraints, and fall prevention strategies. An interdisciplinary team referral process was then created. Each committee lead has an electronic referral form that staff have access to if required. All staff were encouraged to submit referrals to all programs when they had an idea for improvement for a resident, or when a resident required further assessment by a committee member. The leaders reviewed these referrals on their monthly committee day. So some of the referrals include infection control, palliative care, fall prevention, nursing rehab, continence care, BSO, and skin and wound. Next, we created an auditing schedule that helped to identify and verify compliance with all new practice changes and ensure sustainability of these changes. This auditing schedule was then built into the job routine for the registered nurses. Our goal here was to empower the frontline staff to be leaders and to be responsible for maintaining compliance. This assisted in creating a team approach to problem solving. Nursing department team meetings shifted from problem identification and requesting resolve from management to team brainstorming and collectively thinking of ideas on how to enhance resident care. This shifted the culture of the home, and all staff were motivated and dedicated to providing the best care and services for our residents and their families. This attitude was translating into the other departments in the home as well. So here's just an example of the RN audit schedule, and also an example of the audit data collected for restraints and PASD use. So these are examples of audits that were created for champions to complete monthly in their specific program areas. Our skin and wound champion completes a weekly audit of wound assessments, reviews skin and wound interventions and treatments, and works closely with our physician and nurse practitioner to ensure optimal healing. Our falls committee champion reviews all resident falls to ensure documentation is completed and identifies trends, patterns, and interventions. Our continence care team ensures all residents are wearing appropriate incontinence products, updates product lists, reviews toileting routines, voiding diaries, and resident laxative use to identify trends. Our palliative and pain committee leader reviews residents receiving end-of-life care, completes PPS scores, and has end-of-life goals of care discussions with residents and families, as well as tracks pain medication usage and effectiveness. Our BSO lead follows all residents with responsive behaviors, reviews interventions, initiates referrals to our external team, and participates in special care conferences. All of our committee leaders hold regular meetings, whether it be monthly or quarterly, and reviews their findings with our interdisciplinary team and provides ongoing education to our frontline workers. So as I mentioned earlier, one of our ways we sustain our practice changes is by completing an annual gap analysis on the 14 best practice guidelines. So this is a task that the committee leader completes with our RNAO long-term care coordinator. Once areas for improvement are identified, the team creates goals and action plans with the DOC for each program. This process then aids in the development of our home's annual quality improvement plan. This also provides the foundation for our annual mandatory education sessions, which is led by the champions on their particular guideline. The education is developed from the gaps identified within the home. We also use this as an opportunity to identify areas of success. We have found that these education sessions are more meaningful as the education has specific relevance to our home's needs, as opposed to just repeating the same educational content annually. This is a diagram to further explain the continued annual process our team follows to further implement these guidelines and create new quality improvement plans. So in December, the team evaluates their program using the gap analysis tool. In January, they create goals and action plans based on recommendations from the gap assessment. In April, the quality improvement plan is created based on the goals and action plans. In May, all staff education takes place. In June to November, we do some reassessing and reevaluating of the practice changes, and we monitor progress and track improvements. Sometimes there may need to be some re-education. And again, this is repeated annually. So this is really how we stay on track with everything. So as a long-term care home, part of our evaluation does include the MDS report. So MDS stands for minimum data set. This includes 18 clinical assessment domains that are completed for each resident on a quarterly basis. And the information is then submitted quarterly to the Ministry of Health of Long-Term Care, which requires mandatory reporting on the 18 quality indicators. So I've attached some examples of our improvements. So these are some of the quality indicators that our home reports on quarterly. As illustrated above here, our physical restraint use indicator was originally at 21, and by 2019, we were able to eliminate all restraints within the home and have successfully sustained our restraint-free culture to date. Our fall indicator was at 17.5 in 2015, and we are now sitting at 13.6 as of December 2020. And here are two more examples of improvements in our quality indicators. So we found by engaging all members of our team, we have decreased resistance and provided everyone with a sense of partnership. The staff feel valued and they know they all have a role to play. Oops. We have enhanced nursing knowledge and competency, team building, leadership skills, communication, overall resident satisfaction, and overall staff satisfaction. So thank you for taking the time to listen. I really hope this presentation has been insightful and you are able to utilize some of the tips I've spoken of today throughout your BPSO journey. Are there any questions?
Thank you, Alyssa, for a brilliant and very informative presentation. Congratulations on your implementation efforts that are now embedded into your practice at Tilbury Manor. There are some comments that I do see in our chat box. Julia wanted to let you know that she's very impressed about the changes that you've made so far in your organization. And there were some questions from Belverde Heights. They really loved your presentation, but they wanted to know how many champions did you have? And also if you will be willing to share the tools that you have used.
Yeah, sure. So we currently have 13 champions, and they're comprised of both registered staff and non-registered staff. So we have usually an RN or an RPN, and then our PSWs as well.
Awesome.
And yeah, I can definitely send some of the tools we have used to you and Andrea, and you guys can include them with the PowerPoint.
Okay, we'll be sure to distribute that to the group. So we're just monitoring the chat to see if any more questions are coming in. But in the meantime, we're just wondering, did you foresee, what did you foresee as being one of your greatest challenge during this journey or even getting started? What did you foresee as that will be one of your biggest challenges?
For us, I think one of the biggest challenges was to make sure that we had the buy-in from the staff. We knew, right away that if management just presented this and put this out and told them they had to do it, that it likely wasn't going to go over well. We really wanted it to be led by the frontline staff. So that's why we chose to do the transformational leadership style. And we put a big focus on building the confidence of the staff and making them confident leaders. That went hand in hand with reviewing the healthy work environment guidelines right away, because that's what gave them the resources and the tools that they needed. And then the other thing that helped with the buy-in was that, but again, assigning the champions and having them do the education to their peers, and them monitoring the changes and evaluating, because it gave them a sense of leadership and accountability for what was going on in their required program.
That's great to hear. There's a question from one of our participants, Christina. She wanted to inquire, do your champions feel that the 1 day a week is sufficient time to prepare or work on the BPSO work that you're doing in your organization?
Yeah, so it's actually 1 day a month. And that's when they get to sit down and they focus solely on what they're doing, but they also keep an eye on things when they're in for their regular shifts as well. But yeah, that seems sufficient, and that's been going really well for us.
Right. Julie asks, do you find it a challenge to only review programs once a month in general?
No, because we're constantly reviewing them. I mean, I oversee everything. And again, when they come in for their shifts as well, they're getting report and they're keeping an eye on what's going on. Yeah, so no, we haven't had a challenge with that.
Alyssa, I just want to, it's Bev, everybody. I'm the RNAO long-term care coordinator that supports Alyssa and her staff. I'm just wondering, Alyssa, if you want to expand on how your champions are partnered up, because I'm wondering if they're feeling like the champions are doing all the work, where you have a nurse and a PSW who work together for just pain once a month. Can you talk about how you have the two staff working together on 2 guidelines every month, so that it isn't just, 2 champions every month doing all the data collection, etc.? Or do you want me to do it?
Well, sorry, Bev, I don't really understand what you're asking.
Okay, so I'm not wording it very well, sorry, everybody. So what they have done at Tilbury Manor is they have people who are passionate about a topic. So they'll have a nurse and a PSW who do pain and end of life. They have a nurse and a different nurse and a different PSW who will do falls and restraints. They'll have a nurse and a PSW who does bladder and bowel continence, a nurse and a PSW who does wounds, and I think person and family-centered care. Anyway, I'm not going to go through all of them, but for all of the guidelines, there is time for each pair of the nurse and the PSW to have a paid day a month to work on their particular 2 guidelines. So it makes it doable, and they're actually able to perform their slide decks on that paid day for the education required based on the gaps. And they do the data collection, and they revise or update their pamphlets and their gaps as needed.
Thank you, Bev. That's great to hear. There's a question from Sumit. She's asking, were you able to reduce the number of audits that you do and still get sustenance or able to sustain what you're doing currently?
We've specifically created audits for the champions and the leaders to make sure that, the practice changes were being implemented properly, and that we knew if there was a need for re-education. But it has, having the leaders lead that, it has reduced the amount of workload, on myself or the DOC greatly. So I guess maybe if she means the audits for myself. I'm not sure what the question was exactly about the audits.
Yeah, so I'm guessing they're probably wondering if you were able to reduce the frequency of how you do it and still get adequate results in terms of how often you do it. So I think that's probably what was being asked. Mm-hmm. Yeah.
Okay. Yeah, then yeah.
Yeah. Kathy sends congratulations to you, and she mentioned sustainability many times is a great challenge to change. And congratulations on transforming the work that you're doing in your home. But there's a question here from Patricia, and she's asking, she's just wondering with the shortages of staff and in general working short, she's wondering, just one moment. Did this affect your buy-in from champions and your staff in general? So working short staff with what's going on in long-term care, did this affect your buy-in when you done your work with BPSO?
No, I wouldn't say working short staff has affected the buy-in at all. It's made it challenging to sometimes continue with the day a month, to be completely honest, but we've been able to work around those staffing challenges, so we can continue with that. But no, thankfully it hasn't changed the buy-in at all. We've been doing it for so long now, it's truly just embedded in them. And yeah, the quality of care has not diminished at all.
Thank you. There's another question from Catherine. She says, great work on what you're doing, but 2 questions. She wanted you to talk a little bit more about the autonomy of your champions to lead change, as this is critical for success, and also paying staff 1 day per month, recognizing and valuing their time and contributions to leadership. She would like you to tell us about, the funds spent on champions and whether you see a return on investment in terms of improved outcomes.
Sure. So the autonomy, you're right. So that was a big guiding factor for us from the beginning. So that's why we had focused on, providing them with the resources they need to be confident leaders. We realized they weren't, it wasn't going to work unless we guided them and mentored them through that. So, reviewing those healthy work environment guidelines with them prior to is what really set the foundation for that. And then we have, sorry, what was the second part of the question?
In terms of the money spent on training your champions, have you seen a return on your investment in terms of improved outcomes in your home?
Yes, definitely. So what we use to see the improved outcomes in the home, one of the things is the quality indicators. So we have definitely seen an improvement with those. We track those, and I have them on a graph. So that's like visible data, I guess. But then also we've seen the morale in the home change. We've seen the happy family members. It's really improved with our communication between the staff and the families. The residents are happier. It's just overall a more positive atmosphere.
That's great to hear. So looking back at your journey and how far you've come, do you feel that there's anything that you can improve upon?
Yeah, there's always areas for improvement. I think one of the areas that we could improve upon a little bit better is just sharing in our success. We did make it a priority, in the beginning when things were going, when we first started, it was exciting to see the success. And, unfortunately, I think we've kind of not shared it as much as we should in the past few months. Currently, I'm working on putting together a BPSO board that's going to be displayed in a common area to display all of the successes, what we're currently working on, show our quality indicators, just so all the staff, family members, when they come back in, and the residents can all see what's going on and be well informed of the successes.
That's great to hear. I'm just wondering also, another question from our group or participants. They're just wondering, how do you ensure sustainability of all the guidelines that you've implemented? What strategies do you have in place to ensure sustainability over time?
Well, so sustainability, we've created some of the audits for the champion leads to complete, to make sure that what we have implemented is being sustained within the home. We look at our quality indicators to make sure that those are maintained. And then we do the gap analysis annually, again, to make sure that we have, implemented as much as we can, and that we're sustaining the changes that we've done.
Excellent. There's a comment and also a question from another participant. Says, during the champions 1 day a month, I would assume they would perform tracking and monitoring activities as well as developing education and completing evaluations. They're wondering, do these champions also ensure practice changes are consistent as part of their normal daily job routine? Just based on your presentation about building this into evidence-based practice. And can you explain this a little bit further, if they've made this part of their job routine or their day-to-day routine?
Yes, absolutely. So like I said, they get that paid 1 day a month to sit down and really focus and dig in deep and do the audits and do the ongoing education. But that doesn't mean that, when they're not working that shift, that it just goes all out the window. They definitely continue with that mindset throughout all of their shifts. So they're constantly, educating and re-educating if they see a new staff member doing something that's not the proper way, or they're constantly, keeping an eye on referrals to make sure it's not something that's imminent and needs to be dealt with right away. So like I said, it's really embedded in their mindset that they do on all their shifts now.
And one individual is wondering if you've had consider having champions from recreational therapy, physio, and other allied health.
Yeah, that's something that we're looking at as it comes. They do participate in the practice changes, like they are involved. We involve all members from different departments in the education and the training, and but currently we don't have any members from those departments that get the 1 day paid a month, but that is something that we would definitely consider if there was interest.
So thank you. Kathy also asked, how were the residents and the family members involved in the process? Any helpful strategies that you might be able to suggest to the group?
Yeah, so we review everything at resident council meetings and our family council meetings. So that's how we keep them involved with the changes and you know, the successes that are going on within the home.
Awesome. Jen also asks, did you identify any positive impacts to the culture in the home? Example, professionalism, interprofessionalism, or just overall collaboration? And would you be able to expand on this and if these were evaluated and how?
Sure, we definitely did see it was a whole culture shift that we have noticed throughout this process, and we've been able to continue with. I guess that would be, you know, an area for improvement, that we don't have any tangible data to show that it has improved. But like I said, the morale has greatly changed. We did notice that, you know, a decrease in sick calls, and overall staff were just reporting that they're happier, you know, while working.
Can I just add to that, Alyssa?
Sure.
I've also received reports while I've been in the home that such as the outside vendors, you know, the oxygen supplier or the mattress or the dressing, the beds, you know, vendors that have been working with Tilbury Manor for a long time have commented on how much happier and how much what a pleasure it is to come into this home. I think in the beginning when we started this, the very first meeting, there were some champions who felt that they weren't being received in a very positive way. But after we did the presentation on the healthy work environment guidelines of leadership, the conflict management, communicating in a respectful, providing feedback is very, very delicate, right? And the PSWs and the nurses all learned this, as well as all the managers in Tilbury Manor. I think the communication was really improved. So then the respect and the trust was enhanced in the home as well. So even though it wasn't collected overtly, it was very noticeable. There was a huge change in the culture of that home. And I think, Alyssa, correct me if I'm wrong, but I think people were actually wanting to line up to become champions and to be part of this work. So as they integrated into all parts of the home and everybody understood exactly what was going on, there was no resistance or pushback from anybody. They actually integrated this into every aspect of the home.
That's really great to hear. I think the final question that we have here, they were just wondering from the PSWs who are your champions in the initial stages of engaging them in the BPSO work, did you have any pushback and how did you address that?
No, we didn't have any pushback from the PSWs. In fact, you know, once they saw that their colleagues were becoming the champions, they, like Bev said, you know, they were more than willing to join as well, and they were lining up asking if they could become members on the different programs that they were interested in.
Awesome. Thank you so much, Alyssa. You've answered quite a few questions from our participants, and it's been a really engaging presentation this afternoon. And it's really impressive that the work that you're doing within your organization and the focus your staff have in keeping the BPSO work going, even past the designation period, you know, maintaining all those things that they've implemented in the home to ensure that you have continued improvement. It's really great to see. So thank you once again for joining us this afternoon and for presenting on this. It was very, very insightful.
Well, thank you.
So to our participants, we've had a very engaging discussion today and our time is coming to an end. We want to thank everyone for taking the time out to join the webinar today. And you'll soon receive a link from our team of today's presentation. Please let us know of any suggested topics you would like us to work on. And immediately after you've done the evaluation, you will receive a certificate of attendance. Also to let you know that this work is funded by the Government of Ontario. And also again, thank you very much for joining us today. It was a very lovely presentation. Please do enjoy the rest of your day.